Welcome back to our personal safety series, Keep It Safe in Smithtown. I'm John Valentine, your Director of Public Safety, and I welcome you here today to share in this information. The information we're about to provide you offer seasonal safety issues that you might encounter on a day-to-day basis living in the town of Smithtown. We hope you enjoy the program, and please share it with your friends and family. Thank you.
Hi, I'm Elaine Economopoulos. I'm the Director of Horizons Counseling and Education Center, located here at 124 West Main Street in Smithtown. Today we're going to talk about medicine chest safety. Medicine cabinet safety is really an important aspect because I think parents don't recognize how available substances are to their children in the home. Frequently, parents aren't thinking of locking up their medicine cabinet. They're not thinking of taking an inventory and keeping track of what substances are there for their kids to get into. It is something that we have to look at differently. We've had a very casual attitude about substances in the past, and we've come to realize we have to be a little more proactive. First of all, you know, infants are so tiny, so there can be absolutely no mistake in when you're administering any kind of prescriptive medication to an infant, because it would be very easy to overdose in regard to their body weight. So you've got to be vigilant about giving only what is prescribed, when it's prescribed, as it's prescribed with an infant. You certainly don't want to take it upon yourself and give them any kind of medication to help them sleep or, you know, to quiet them down. That would be totally inappropriate. And you absolutely don't want to be giving children under the age of 4 any over-the-counter medication. Go only with whatever the doctor is prescribing and be very careful about the administration of it. So keeping in mind, toddlers can get into all kinds of things. Don't keep medication on your nightstand. Don't keep it in your coat pockets. Don't keep it anywhere the child can reach or climb to. Make sure that it's always kept out of reach, and if at all possible, locked up. You know, adolescents are going to explore, adolescents are going to experiment. There's a fallacy for them. You know, they think just because it's a prescribed medication, it can't hurt them. You know, it's not a street drug. It's something that doctors prescribe, that people take when they're not feeling well. So there's this sense of safety. They don't really see the danger that we know it can pose. So as parents, I think we have to be very, very vigilant about monitoring what's in our medicine cabinets and what medications are being used and when they're becoming depleted, and maybe not even having them on hand unless you need them for a certain amount of time. And then dispose of them properly. Don't keep them at hand. We know kids will start to use and experiment, but we also know they're going to start with what's easily available to them. They're going to go for what's accessible. Substance abuse is not a new phenomena. Our kids have been doing it generations and generations and generations ago. We've had different substances that were of concern to us. Right now, I would say the culture supports it very well because, you know, so many prescriptive drugs are so available. In that respect, it's changed a little. It's not so much the street drugs, it's now prescriptive medication. Things that are FDA approved, you know, they're coming through patented. We know that they're good and we know that they work. So the choice of drug may have changed culturally, but the problems are still the same. You know, kids are using, and we know that's a dangerous thing. We lose a lot of kids every year because of substance abuse, and we're still trying to deal with this issue and find out ways where we can reduce that. Seniors, that's a wonderful topic because as we're all getting older, we've come to realize that there's more and more medication available to us to really improve the quality of our life as we age. The downside to that is that it's an awful lot of medication, a lot of different prescriptions, and a lot of opportunity to confuse them, mix them up, and overdose on them. So I do encourage, when you are a senior and you're on multiple medications, there are all kinds of tools to use to keep your daily supply or daily requirement of medication organized. It's nice to have someone give it a second look just to make sure that you've got all the right pills in the right place, that you've taken them on the appropriate days and you haven't taken it twice in the same day. These are all little tips. I think everyone could use a little bit of guidance in that area because it does get very overwhelming when you're managing 13 different prescriptions. Some have to be taken in the morning, some at night, some with food, some before you go to bed. If you are working with a senior, help them out with that, give it a once-over, make sure you're keeping an eye on it. You know, I think the strongest form of prevention really lies in the obvious. It is your relationship with your child. And I know that very often parents are convinced that the kid right now is really rejecting you and really non-receptive to you and that you have no influence on what's going on. Don't believe that. You do. You have an awful lot of influence as a parent, and you're going to use your responsibility to provide a safe atmosphere. You know, you're going to make sure the environment is drug-free as much as possible, but don't underestimate that it's really your relationship with that child that's going to be the protective factor in dealing with drug abuse. The first thing you want to do is you want to keep communication open. Again, it is very natural for an adolescent to be shutting down a little from his parents because they've got other tasks involved. They're trying to explore who they are as a young adult in the outside world. And by that nature, they push the family away a bit. So they're gonna be pulling away. Parents need to be very open and willing to communicate with them despite the fact that they're not being received all that well. Always offer opportunities to spend time with them. Keep mealtime, you know, a family affair so that you have an opportunity to kind of see how the day is going, how they're feeling, what's important to them right now in their life, check in with them on a regular occasion. If you're noticing something's wrong, speak to them about it. Talk to them. Be open about it. It's a subject you're willing to take on. You're not gonna shy away from it, and you're not gonna be blind to it. You are making it clear it's unacceptable. You're not gonna let it happen in your home, and you're gonna do everything you can to make sure that it doesn't go on. I do encourage parents to keep the medication under lock and key at this point in time. And it may not be because, you know, you're concerned that your kids are taking them necessarily. Keep in mind, your home is open to other children. Other people will come in. Your kids' friends may come in. And you have no way of knowing if they're going through your medicine cabinet, if they're pulling a couple of the pills out. You don't want to be a party to any of that. You want to make sure that you have nothing in there that can be harmful to anybody and accessible at the same time. So the bottom line here is that you really want to take all of those accessible medications out of your home. You don't want to store them. You don't want to keep them. You either keep them under lock and key if you need them on a regular basis. If you don't, you want to dispose of them, and you want to dispose of them properly. Take the medication out of the vial, remove the name of it, combine it with maybe some kitty litter or some coffee grinds in a Ziploc bag, throw it in the trash. You want to make it inaccessible to anybody else to pick it up, even out of your garbage. Don't flush it in the toilet. We don't want these medications to get into the water system either. Keep in mind, it only comes into your home because you're bringing it there. So if you're not going to need it, if you think that you're getting a prescription that's overfilled, if you are getting a prescription for 90 pills of something that you don't think is going to require 90 pills, ask your pharmacist, can you hold back on the prescription? Just give me a week's worth or give me 10 days worth. And then if you need more, you can always go and pick it up. But the point here is you don't want unused medication laying around your house. If it's there, it's available, it's accessible, it's dangerous. Horizons Counseling and Education Center is a community-based, drug-free outpatient program available as a resource to do treatment, prevention, and recovery. And we do work with all ages. We'll work with seniors, we'll work with adult populations, and we work with young adults and adolescents. Very often parents are coming in when we're working with the adolescent. Very often it's the parent that makes the first call and says, I'm concerned, I've noticed some things, I need some information, I need some education, I don't know how to approach this. We have groups for parents, we have groups for young adults, we will bring the family in. We'll work with everyone to get them all kind of rowing in the right direction. If a parent is concerned and says, I know my child has a problem or my young adult has a problem and they're refusing counseling, Horizons has a group for parents for just that situation where the substance abuser is refusing treatment. We'll work with the parent because we recognize that you start an intervention at any level you can get in. And if the parent starts changing what they're doing, it's going to change everything that goes on in the home. Here in Smithtown, we have the Smithtown Youth and Community Alliance, where people come together every month and discuss what's happening in our community and what are some of the risk factors that we can address, what are some of the protective factors that we can help support in order to raise a real healthy adolescent in our community. We're looking for healthy communities. We know that's what raises healthy children. If you're interested in participating in the Smithtown Youth and Community Alliance, contact Horizons Counseling Center or the Smithtown Youth Bureau, and we will be happy to give you the information of when our next meeting is. Everyone is welcome. Come, sit in, see if you enjoy what you're learning, and you'll decide whether or not you want to come back. One of the things we do is we offer resources to parents to keep a safe environment in their home. We have a medicine cabinet inventory form that we can work with. We have a drug guide for parents so that they can learn the facts about the commonly abused drugs. We have drug-free literature for working with young toddlers as well as elementary school children. It's very important that parents know the facts, and we can give them any information they need as well as how to talk to their kids about drugs. If you have any questions or are seeking either treatment or education, our phone number is 631-360-7578. You can also access information about our programs off the web, www.smithtowninfo.com/horizons. We'll speak personally to you and answer your questions.